So this one has a really good battery life. So if you need it, just raise your hand and I'll pass it on to you. I'll pass it on to you. You have 4 in the car. Good, good deal. So let me tell you, I have one for the house, one for the car, and then one for the office. Yeah, they all are the same. So we really, really want to thank you. So we have people here in person, and we also have some virtual participants. So we want to thank everybody for being here. Just know that this is a safe space. Everything that we talk about is related to some things that have kind of been taboo for so long, but this is an open space. Feel free to ask your questions. Feel free to share your experiences. We have an expert panel scheduled to talk to you tonight. And so for just housekeeping rules, we have some light bites over here. Raise your hand, Ajay. Yeah. She has some light bites over here. The restrooms are down that way by Brian. Brandon. I talked to a Brian earlier, sorry. Brain fog. Symptom of menopause. Thank you. Gosh, it happens. My friend Brandon, yeah, 3 cents. So we're going to have a very stimulating yet laid back conversational style panel this evening. And we're going to start off by introducing the one and the only Miss Tanya Stevenson. Come on up, Tanya. Tanya, thank you for curating this phenomenal event this evening. So I'm going to just give you some information about Tanya that you may not know. Okay? Doesn't she look great? You do. You do. You do. Go get the fan right there. It's right there. All right. So let me give you some information. We can have a little music playing as we do this. Okay. Just to, set the scene. Yeah. All right. Tanya has been in Atlanta for quite some time. She has been deeply rooted in the community for over a decade. In 2013, she started Stretch ATL. She did, yes, absolutely, absolutely. Her boutique stretch therapy practice caters to a wide range of client classifications, from those who are sedentary, to fitness enthusiasts, to even professional athletes. She strives to help her clients recognize the importance of stretching and how the practice yields better recovery, increased range of motion, and contributes to optimal health. Her commitment to progressive wellness led Tanya to design a certified professional stretch therapist program so that the dynamic practices of stretch therapy can be spread outside of her client base. Dr. T, as we affectionately called her, and she's a true doctor because she's a certified practitioner of massage therapy, reformer Pilates, reformer Pilates, and bar. She has a doctorate of chiropractic from Life University and a BS in biology from Southeast Missouri State University. Yes, give it up. Did you all know that about Tanya? Yes, she's amazing. She's a doctor. She's a doctor. All right, so Tanya, that's Tanya. All right.
Thank you.
Yes, go ahead and have a seat. Yeah, Let's see, who do we have up next? Dana Mitchell. All right, come on up, Dana. This is Dr. Dana. Yeah, we have some very impressive panelists here today. I don't have my glasses, so I'm holding it back so I can see. Yes, Yes, let me have a doctor. Yeah. Dr. Dana Mitchell is a doctor of physical therapy with over a decade. Yes, thank you, doctor. Yeah. Oh, much better. With over a decade of experience specializing in pelvic health and trauma-informed care. She holds advanced certifications in orthopedic therapy and Pilates. She's also known for her ability to blend clinical expertise with culturally responsive care, particularly for Black women and underserved communities. As the founder of Doc B Pilates and Wellness, Dr. Mitchell offers virtual and concierge services that help women restore confidence, mobility, and strength during the transitions of life, such as pregnancy, postpartum, and menopause. Dr. Dana is passionate about reshaping how we talk about pelvic health and aging, creating a safe, informed space where women can feel seen, supported, and empowered. Let's give it up for Dr. Dana. All right. All right, up next is Carly Harvey Raymond. Yeah, hey. Carly Raymond is an entrepreneur, an international host, a magazine editor, wife, and mother. She's a graduate of the Ohio State University. She became committed to service at a very young age. She can often be found serving as a mentor to young women and a style guru for women on a budget. Carly fancies herself as a home chef, cooking up gourmet meals for her family as well as her friends. Carly is a lifestyle maven who can turn the mundane into spectacular and make any situation, stage, or room sparkle. Let's give it up for Carly Raymond. Woo-hoo. There she is. All right, we're going to continue on. Our next panelist is Barbie Jones. There she is. All right, so Barbie is a certified detox coach based here in Atlanta with over 15 years of experience in holistic wellness. Her passion for detoxification led her to become a personal raw juice chef, catering to the client's unique health and wellness needs. In 2019, she earned a certification in nutrition through raw juicing, which further deepened her expertise. Barbie is also the co-owner of House of Tea, a wellness tea company she founded in 2021. Her dedication to health and healing has attracted a high-profile clientele, including Brandy Evans, Shannon Thornton, and Kecia Sharp, just to name a few. Let's give it up for Dana Mitchell. Yes. All right. And sorry about that. Yeah, brain fog. Dana's right here, Barbie. Yeah. Yeah. Mm-hmm. Yes. Barbie Jones. Give it up for Barbie Jones. That's right. Yes, Barbie. Thank you, Rossi. Thank you. She didn't even say anything. Yes, she did. All right, so let me get my next page. Mm-hmm. Thank you all for being so compassionate. We appreciate it. All right, and last but not least is Dr. Belinda Brown-Sadler. Yay! Dr. Belinda Brown-Sadler has been practicing medicine for well over 20 years and joined Piedmont Healthcare in 2005. 2005.
Yes, that's correct.
Thanks for the compassion. Thank you. She received her medical degree from Case Western Reserve University of Massachusetts, and prior to Ohio.
Uh-huh.
Oh, that's Ohio. Yes. And prior to joining Piedmont, she was active duty in the United States Navy and served as a physician at the Naval Ambulatory Care Center in Connecticut. Did you all know that?
Man, I'm amazing.
Dr. Brown-Sadler is known for her warm personality and her belief in caring for the whole person, physically, emotionally, and spiritually. She's now participating in Piedmont's new concierge program, where she has the opportunity to unite her personal passion for wellness, disease prevention, and health promotion. Her areas of focus, a little bit more, includes managing chronic and complex health conditions. She has an emphasis on preventative medicines specific to women and men, and also the integration of nutrition and fitness. We know that she's a workout queen. We know that, right?
That's key.
That's key. So let's give it up for Dr. Belinda Brown-Sadler. All right. So we have our esteemed panel here. So first, before we get started, let's do something just to kind of break the ice just a little bit. So turn to the person near you, our panelists included, and think of a song. We're going to incorporate some music here. Think of a song. What's the first song that comes to your mind when you think about menopause? Share it with your neighbor. I'm thinking a lot of people are thinking the same song. The same song. We're gonna start over here with Aphrodite and Nikki, and then we'll go around the room. Aphrodite and Nikki, what was the song that you all came up with? What was the first one?
It's getting hot in here.
Yeah.
Take off all my clothes.
I am getting so hot. I'm gonna take my
clothes off.
Right. All right. What was the first song that you all thought about? That one too? Yes, that's a popular one. Go to the next. Okay. What about you, Tanya? Rossi?
Since I'm probably the oldest person up in here, I think of fire.
That's a good one. That's a good one. Not yet. Okay. Okay. Keep on living. What about LaShonda and San? Oh, go to Mike.
Trying to be on my best behavior.
That's okay. But what song did you think of? On me, let your SWV song. Rain on me. That's good. That's good.
Or New Edition. Just
You
let
got
it
one? What you got?
It's raining men. Hallelujah. It's raining men.
That's good. That's good. You got what? Okay, what you got?
So this song is really what menopause would be singing to me. Ain't no mountain high enough. Ain't no river wide enough. Keep me from you.
That's a good one. That's a good one.
Right.
Hot in here. Yeah, that's a very, very good one. Okay, Tanya, what comes to mind when you think of menopause?
Too hot, baby. Hey, you know that song?
I know that. I know that. All right.
It was definitely Nelly, hot in here.
Yes.
Okay, I've spent a lot of time thinking about it, and I still really don't have one. But I would probably say Bobby Valentino, slow down. I just want to get to know you. Because you're going to have to get to know yourself at this new stage of life.
I say Nelly.
This girl is on fire. Alicia Keys.
That's a great one. Beautiful, beautiful. And for me, you know, I was raised by my grandparents who were both ministers. My grandmother was an evangelist. Grandfather, he was a reverend. And so I think back on Christian music. The old school, the old hymnals. So what I think about when I think of menopause, the song that I think about is I'm coming up on the rough side of the mountain. Let's take it to the bridge. I'm doing my best to make it in. Yes. Yeah. Yeah. The old school songs. Yeah. So, yes. So, all of our panelists are here and they are ready to answer your questions. What questions do you all have? Where do you want to start? Yes. And we do have white, what you call those? Postcards? Little index cards. So if you think of something, you might want to go ahead and jot it down because the brain fog is real. You might forget. So just jot it down if you have any questions. Yes, go ahead. Mm-hmm.
So what I see more than anything, and since you all are in this space, you may be able to speak on this. I feel that women are experiencing this much younger than we did. Like at my age, I didn't experience it young at all, but like my nieces in their like early 40s, everybody has a fan now. Like, yeah, notice that everybody carries a fan around. I know climate is, well, that's a whole other thing. But are you seeing that more women younger are experiencing? I would have to say yes. I totally agree with you on that. I try to calculate that to the food that we eat and how the food is brought to the table now. Different. The way we eat, everything is so expedited. So we want fast. We want fast food. I didn't eat at fast food restaurants. I didn't eat at fast food restaurants all the time. When I was a kid, we had hamburgers at home. You know what I'm saying? So we didn't have the McDonald's and the McNuggets that have those chemicals in it that are hormonally changing our babies' bodies. Yeah, I agree with you. I see menopause, premenopausal occurrences and symptoms as early as like 34, 35. Mm-hmm. That's unfortunate. Mm-hmm. Yep.
And the average age for perimenopause starts also in your 40s, so it's fairly young because perimenopause can last for 8 to 10 years. So it is common, yes, to start in the 40s, and if they start younger than that, and that's definitely like very early, yes. But the chemicals in our foods, the hormones, and all of that makes a difference.
One other question too. Do you all think that since we know more about menopause now than we ever did, right? Like, do we really know that menopause or perimenopause didn't start earlier because we didn't study it? Like nobody studied it. Like, yeah, we weren't educated on it. Right. Is it like the thing that comes right after menstruation? Like menstruation, right. Like So I think about that too. Like, we know more about menopause now, but really, when does perimenopause really start? That was just a comment.
Well, as we age, it's estrogen and progesterone are the hormones that are responsible for our reproduction, our sexual characteristics, and so forth. And as we get older, they become less and less. And usually it is in the 40s that they start to decrease. Right. A lot of people would say, oh yeah, your body's gonna change once you get to 40 and so forth. And so it has to do with the decrease in the estrogen and progesterone that's in our bodies. Okay. Mm-hmm.
I have another question. This was, because I need, there's things that people just need to hear. And this one is for Carly. Sex and menopause. I have a lot of followers who are menopausal. And these are the kind of messages I get in my DMs because people are afraid or ashamed to say it out in the open space. And they talk about vaginal dryness, painful sex, bleeding with pain, bleeding with going to get a pap smear, whatever. So can you talk about like what things that people can do in that space to help with your, since you just
yes. Okay. So I don't know what bio that was read, but I do have a much better bio that is very current. Because I was like, well, who the hell is that? All right. I think that was the old me. So, but hello, I'm Carly Harvey-Raymond. It's the new me. But no, I became a certified sex educator a couple years ago. And so it's been such a journey, but I get a lot of questions on menopause. I do talk a lot about sex education for adults, and how to be confident, create new confidence, to boldly say yes, but confidently say no when you don't want to. But I help build women's confidence to get the sex that they truly desire and deserve. So yeah. So when it comes to menopause and sex, yes, your body is going to change. It is going to change. The uterine lining becomes thinner, so you're not able to produce as much wetness that we had before. So when you used to be like, oh my God, I was so wet, I was so ready for sex, right? Now you're like, it becomes more difficult. That's when lube comes into play. And so lube is one thing that we can do to incorporate, because wetter sex is better sex. All right? And so why wetter sex is better sex is because when we do not have wet sex, when we're not ready for sex, because wetness is just an indicator that the brain sends to the body that says, I'm aroused. It doesn't mean ready. Okay? Wet does not mean ready. It just means, oh, I'm thinking about sex. I mean, I could if I wanted to, but I can get wetter. Okay? So when we think about arousal and how that changes, we're not able to produce as much mucus as we used to before, right? So that's when we think lube is going to be your best friend. And most women, they shy away from lube. You know, I hear from the young girls, oh, you know, in the rap songs, they shame you. Lotto, Nicki Minaj, all the young girls, they say, my pussy don't need no lip gloss, or whatever they say. Oh, I use a lot of colorful language, so just get ready. All right, because if you having sex, you're not saying, oh, your glorious penis. You're saying what that dick do, okay? And he's not saying, oh, I love your vagina. It's so yummy. No, he's going to say, let me get some of that pussy. All right, so we got to get comfortable with the language, okay? So wetter sex is better sex. So lube is going to be so important when we're having sex at whatever age, right? So even if you're young or even if you're older and you're in menopause, lube is going to be your best friend, because when we're able to alleviate the lacerations and tears, we eliminate the ability for bacteria and infection to grow and breed. So when we have all those little lacerations and tears, that's when we're looking at more exposure to sexually transmitted infections, when we're looking at more bacteria forming. So we want to have wetter sex. It's not an attack on your womanhood if you're using lube, okay? And I get that question a lot. Carly, please, my pussy is wet. I got an Aquafina flow. All right, that may be true. I love that for you. But the Aquafina flow doesn't always happen all the time, okay? Because we have things that disrupt our pleasure. So not just menopause, but we think of shame, trauma, stress, all those things take away our ability to have pleasure. So guess what? That's going to impact. If we're stressful when we're in menopause, brain fog, we can't think, we can't settle down, our bodies can't become calm so we can actually be in a present state of enjoying sex, we're not going to be able to activate the arousal. So guess what? Lube is going to be important. Also, when it comes to sex at this age and thinking of how it's changing for you and how you can really embrace the transformation, think about new ways in which you like to be turned on. And so the things that turned us on in our 20s are not going to be the things that turn us on in our 40s and 50s. That man could look at you, whisper some sweet nothings in your ear, and you would be like, I'm ready to go. Well, at 40 and 50 years old, you like, if you say one thing, I swear to God, I'm going to burn this bitch to the ground. Everything you say, I swear to God, I'm going to kick you in the teeth. So it's going to be that, right? Because now you don't have the patience and bandwidth that you had that was more accepting for sex, and small little innuendos that would get you turned on, they don't really fit the bill anymore, right? So when we think about arousal and sex as we get older and mature, that means like, how do we rediscover our fantasies, our desires? What are we able to say and get honest with ourselves and say, you know what? Maybe I wasn't into that 10 years ago, but I'm willing to explore what that looks like now. Maybe I wasn't into solo sex, which is masturbation, because I get a lot of women who say, Oh, I don't play with my pussy. That's something, well, okay, if you don't play with it, how you want him to play with it? If you don't look at it, how you want him to look at it? You don't taste it, but you want him to eat it up. Well, wait a minute. We moving backwards. And so, so I do sex classes all the time. So I do one tomorrow. If you want to come tomorrow, I'll be available. 8 o'clock, I'll be at Cliche out in College Park. But so I do sex classes all the time. So I want people to get comfortable with the conversation around sex, because only when we get comfortable, we're able to actually talk about the things that we truly desire. So yes, menopause is going to change how wet we get, but also we have to reframe our desires. We have to say to ourselves, well, you know what? My husband, I'm into working out, but maybe he's not into working out. And so maybe that's the thing that's not making you attracted to your husband, which also brings down the desire level too. Because most women, if some women are in the gym and then the husband is not, or the husband's in the gym and the woman is not, now you're like, well, wait a minute. I'm feeling good about myself. You still looking the same. Well, I don't like it. And it's okay to say, I don't like a belly. That's okay. That's okay, but we have to get honest with the things that we truly want. Also, using supplements is going to be important. I know someone's going to talk about hormone replacement therapy and sex and how it change your libido and how you're able to show up better, to have better sex and a more comfortable life. But also, if you're not into hormone replacement therapy, there are all sorts of holistic routes you can think about. Maca root, we were talking about it earlier, ashwagandha, horny goatweed, evening primrose, wild yam salve. It's really great as people who can't necessarily do the hormones. I get a lot of women who say, I can't get on hormone therapy, replacement therapy. So anything like that where we're thinking of like things that will naturally change, help to bring down our symptoms, then it's something we should consider. But wild yam salve, evening primrose, dong quai, what else did I say? I'm not in menopause, but I just had a brain. So I was just thinking, make sure I said everything.
So I'm going to piggyback off the holistic side of things when you're talking about menopause. Everything Carly just said, but you can do coconut water, you can do mango, you can do pineapple. Those are things. Watermelon season is here. Seeded watermelon is everything while you're going through menopause. I mean, it's less than $5. Juice it, eat it, smooth it up, however you can get it into your system. I also have a blend specifically for low libido, vaginal dryness. It's called the Juicy Peach. You can sample it back here. It has a lot of the herbs combined, what you just said. So these are things that you can do along with, the medical route as well. So, but coconut water is the business, y'all. People think hydration comes from H2O. It's coconut water is everything. And you really see the benefits quickly. Seeded watermelon, when you juice it, you see it quickly. So these are natural hydration things that you can do other than H2O. Your fruits, it's summertime. Eat apples, grapes, mangoes, pineapples, papaya. This is what it's for. So people just, skip over that part. Use your fruits.
Miss Barbie. With that being said, when do you recommend, I know I hear a lot about when you juice, you lose out on the nutrients that are in the fruits and the vegetables. So do you recommend actually like blending it?
I recommend both. So when it comes to juicing, people get confused with juicing and blending. So juicing is the fiber removed from it. Smoothies is the fiber intact. I do both. I love both. So some people will do a smoothie and they call that juicing. That is the incorrect term for that. Juicing, it has no fiber. Juicing is for healing. So if you have a health issue, female womb, fibroids, endometriosis, you want to go with juicing to heal first because your body has to work zero to get to the cells. So juicing is absolutely important. If there is any female issues that you have, you can name one right now and I can tell you a recipe. Juicing is superior. Now, when you're talking about maintenance, you want to transition into your smoothies. But either way, you don't have to go out and get a juicer. People think, I got to have the nice Nama J juice or whatever. You don't. You can juice with a blender, actually. It just depends on what you're trying to heal. But juicing goes directly in your mouth. Within 5 to 10 minutes, it goes to your cells. It's not a game. It's something that you can heal your from the top of your head to the bottom of your feet. Fiber, some people are having issues with colon and digestive. If you're not a person that goes like 2 to 3 times a day, then I would say smooth it versus juicing because of the fiber is still there.
I just want to piggyback on what Carly and Barbie said. So I do have actually a list of herbal supplements and herbal remedies that you can take the handout and that for different for treatment of your different symptoms of menopause. Natural herbal, okay? And then also what Carly said as far as the lubricant, water-based is what you want. That's the best, water-based, okay? Yeah, okay.
Silicone irritation, if you're using toys, no go for silicone.
Right. So you want water-based. Oral is excellent lubricant. Oral sex, excellent. Okay. Gets you aroused, gets your juices going. Fluid, natural. So, ladies, just keep that in mind.
Yeah.
Hi. We're talking about lubricants, right? So I actually brought some lubricants that I recommend. So I have a water-based lubricant, which is always going to be the best, but I also have a silicone-based lubricant, which is the only one that I recommend, which is Uberlube. But in those cases when lubricant doesn't work, where increased foreplay doesn't work, when all these things don't work, that's my job. So we think about sex and we think about, oh, the vagina, but there are muscles down there. So if muscles are tight, if you're having pain, if you think about cesarean sections, vaginal births, all these other traumas that come to your pelvic floor, they're muscles that also need to be treated. So you can, if the lubrication doesn't work, if increased arousal and foreplay doesn't work, that's where you come to me. A lot of times we don't talk about it because you're not gonna go like, hey girl, I tried to have sex with my husband and it hurt. No, we don't talk about it. As a woman, I always say like, we don't talk about what goes on below the belt unless it's on fire or a baby's coming out of it. We don't talk about those things. So sex should not hurt at all. So if sex hurts, you need to go a little bit deeper. Go find information, figure out why that's hurting, and then do the things you need to do to make sex better for you and your partner, because sex is beautiful, right? But it also shouldn't be painful.
So Dana, I have a question for you. So pelvic floor health is often overlooked until there's a problem.
Yeah.
So why is it so important during perimenopause and menopause, and what are some things that we can do at home?
Very important, because a lot of times what we need to do in the beginning, especially even before perimenopause, in our teens and our 20s, is learning how to use your pelvic floor muscles, right? They say, oh, do Kegels. Who knows how to do a Kegel? How many of you guys know you're doing it? How many of you guys know that you're doing it correctly?
Yeah,
Okay. Okay, so we gonna test it. We're gonna test it. Go ahead and do it right now. Go ahead and do it right now. Do it right now. Okay. Okay, it's looking good. But a lot of times when women come to see me, I see this. Like, I've been doing my Kegels all day. No, ma'am. No, ma'am. That's not it. Right. And so our pelvic floor muscles, we have 2 types of muscles. We have muscles that contract quickly, and then we have our endurance muscles. So those muscles, when we coughing, we laughing, those are those quick flicks. We also need those endurance muscles that allow us to make it from here to the bathroom, right? Look, that's the ultimate test. Because he being here like this, that's the ultimate test. But it is really important for you to become familiar with your pelvic floor. I tell patients, get a mirror. Like, when you contract, you should see things elevate. You shouldn't be seeing things coming down towards you. If you're holding your breath, clenching your butt, bearing down with your tummy, you're not doing it right. That's not correct at all. So it's really good to know about those muscles, learn what they do, learn how they work, to prevent some of the other things that can happen, such as prolapse. And prolapse is one of the big ones. And prolapse doesn't just happen if you had a baby. Prolapse can happen, period, as we age. And prolapse is basically when the things that are inside your uterus, your bladder, your rectum start to actually come out. So a lot of what we should do is preventative. We don't do a lot of it, which is why people come to see me and they've been dealing with things for 10, 20 years. So if you can really start to learn how your body works, get in your doctor's office, a lot of times they're not gonna know. But advocate for yourselves and ask for a referral to a pelvic floor physical therapist. Now, if they come in, they're like, oh, just do Kegels and that's it, you need to find another therapist because they need to assess you to know if your muscles are working. Are they working like they're supposed to? Are you compensating? Are you using your inner thigh where you're not supposed to? We're gonna look into what you're drinking, what you're eating. We're gonna talk about your sex life, your birth history, all of the things that come along with that. Because there's some hidden things like tailbone pain, hip pain, lower abdominal pain that can come, and you have been everywhere because you can't figure out what it is, and sometimes that's coming from your pelvic floor.
Now, what's an assessment include? I'm sorry,
Okay, so we have day one. You come with your paperwork. I'm going to do a thorough history. I'm going to ask you what you're eating, what you're drinking. I'm going to get to the nitty gritty of those things. I'll also do a full assessment of how you move. Like, I want to look at how your back moves, how your hip moves, how's your body actually moving. Because a lot of times we're like, pelvic therapy, let's look at your pelvic floor and your vagina. No, what connects to it? So I'm gonna look at those things first, because a lot of times we can have what be muscle imbalances that will lead to other things, right? So I'm gonna look at that, roll out that. If we have time, I will do a pelvic floor assessment. What does that look like? Where are your muscles? They're in your vagina. I gotta look at it. So the things I'm gonna look at is how are you contracting your muscles? I'm gonna also assess to see if there's pain. We have 3 layers of muscles: superficial, secondary, and deep. We gotta assess all 3 of them. So are you getting proper closure? If you cough, do I see your pelvic floor contracting, or do I see things coming out towards me? I'm gonna look and see how strong are your muscles. We have a grading scale, 0 to 5. I'm gonna look at the coordination. Like, can you do a contraction correctly without holding your breath, bearing down, squeezing your butt, using your inner thigh? I'm gonna look at how long that contraction can hold. We're supposed to be able to hold that contraction for 10 seconds at the same strength. So you can hold for 10 seconds, but if you do it and then it starts to diminish off, that doesn't count. So those are things I'm gonna be looking at. And then also I'm gonna look at pain. Are there any painful areas? Because people think, oh, I have incontinence or leakage, my muscles are weak. Your muscles could be short and tight as well. So if your muscles are too taut to give you adequate contraction, then you're not someone that should be doing Kegels. So that's why if you're having leakage, you're having these other things, painful intercourse, you're having chronic constipation, a lot of times they're like, oh, just do Kegels. No, baby, those muscles are already too tight, and we need them to learn how to relax first before we even then start working on strengthening of the pelvic floor.
Dana, do you know if insurance covers pelvic floor therapy?
Yes, Atlanta's a little strange, y'all. A lot of the pelvic floor therapists in the Atlanta area do mainly cash-based pay, but insurance does cover pelvic floor physical therapy because it's just physical therapy. Now, some insurance require authorization, and the difficult thing with that is if you're a man and you're having erectile dysfunction, you're automatically gonna get covered.
Yeah.
But if I'm telling you, if you're saying like, hey, I can't make it to the bathroom without peeing on myself, I'll get 4 visits. So it really depends on your insurance company. It's really good to advocate for yourselves, but that's why doing a thorough evaluation is important, because a lot of times if that's going on, there's something else. There's a history of back pain, there's tailbone pain, there's hip pain, there's weakness, those things, it would just go off. I'll switch. So it's just important to advocate for yourselves. And in those cases, they do have, a lot of us will do cash pay. I work in a company, but I also do concierge physical therapy where I come to your house on a cash pay rate. So it really just depends on what you're looking for.
So I also have patients that come to me with incontinence and difficulty holding their urine. So I also, in addition to handouts on herbal supplements or herbal things, I have some handouts on some exercises that you can do, not just Kegels, but some exercises that you can do at home to help to strengthen your pelvic floor as well. Because the thing is, as your estrogen decreases, that affects your pelvic floor. And so again, with menopause, it's not uncommon to have increased urinary leakage and frequency and urgency and not making it to the bathroom in time. So if your doctor, which I do, gives you a referral for pelvic floor therapy, more than likely your insurance will cover it. Okay.
It was great that you said that it's common. Common doesn't mean normal. So a lot of times we're like, oh, I laugh. I'm supposed to pee when I laugh. You're not. You're not supposed to be peeing when you laugh, you cough, you sneeze. That's not normal. So if it happens, we need to get it fixed. Because if it's happening now, it's going to get progressively worse. And when we think about like the cause of like pads and adult diapers and those things, the number one cause for admittance into skilled nursing facilities is incontinence. Yep, that is the number one cause for your kids, grandkids to say, "Mama, you gotta go." It's incontinence.
It is.
You would think it would be dementia. It's incontinence. So, and it's something that can be fixed. It's something that can be fixed, and it's not something that you should be dealing with because it also sets you up for UTIs and other infections. So it's definitely something that I tell people it's not a laughing matter. It's something that we really should pay a lot more attention to.
So, just to piggyback for when she said skilled nursing, I've been in healthcare case management for a long time, and that is one of the number one things that I have been having to place my clients in nursing homes concerning that. And not only that, they also have to look out for wounds. Sacred wounds are the worst wounds to try to heal. So it's very important. But my question was, because I am in this, I've been in this arena for a long time, and we're just now having conversations about the pelvic floor. So what are some things that I can actually take back? My clientele is honestly, they're low income based probably, majority of the time. And because a lot of times now, most doctors have went to the concierge service, it has been really hard for me to recommend services to them or who to talk to. So what are some things that I can take back to my clientele or to my community and have a conversation with them about the pelvic floor? Because it's really hard. And we're talking about, I might have 20-year-olds, 30 years old with issues with the pelvic floor.
So some easy things that we can talk about now. Number one is having them be transparent about what's going on. So if they are having leakage, or if they are having chronic constipation, if they're having painful intercourse, those are things that they actually need to be able to openly discuss. Some things you can take away right now are telling them like, hey, like coughing, laughing, sneezing, peeing, not normal. So do you know what your pelvic floor muscles are? I actually gave you a handout that tells you how to find those muscles. I remember being young in college and I was reading Cosmo, and Cosmo said, every time you go to the bathroom, you have to squeeze. No. So you can do that to locate those muscles, but we don't want to just squeeze and hold that all the time, right? Because once urine leaves your bladder, it's no longer sterile. So if you're squeezing muscles and you're bringing stuff back up, that can cause infection, right? So the first thing is teaching them how to locate those muscles. So we want to take a deep breath in, exhale, try to lift, right? If you're squeezing your butt, if you're squeezing your stomach, you know you're doing too much, right? So another thing we want to talk to them about is, what does their diet look like? How much water are you drinking? Are you drinking any water? Are you drinking any juice? Are you going to the bathroom? Are you having bowel movements? If you're telling me you go and have a bowel movement once a week, we need to talk. So that's when we start talking about your diet, right? So what are you eating? Fruits, veggies, green stuff, right? We need to add that in, some fibers, insoluble fibers. We also want to talk about like improper voiding habits. It's not normal for you to say, I haven't been to the bathroom in 4 hours. It takes 2 to 3 hours for your bladder to fill. So if that's the normal, if you're going 4 or 5 hours, you're putting so much stress on your pelvic floor that will cause you issues later. So those people who I call the camels are the ones that later are coming to me with urgent continence, because now when they have to go to the bathroom, they're running because your body's like, you're not listening to me when I'm sending you all the signals to go. So it's going to yell at you, and that's where you have leakage. So I think a lot of it is talking about what their daily life is like, setting expectations for voiding. I know we talk about water is 64 ounces. It's actually half your body weight in water, in ounces instead of 64. The little 64 is cute, but it's half your body weight in ounces. So you want to get that in right. You want to make sure you're getting right. You want to make sure you're getting your water in, but also make sure that you're living really a good diet in as well. But we can talk because I would gladly come and give some information talk as well. There are a lot of our local hospitals that do have pelvic floor therapists that still take insurance. My company is, I'm one of them. We still take insurance and we take Medicaid as well. So the issue is if they will pay for it, because a lot of times if it's chronic, if it didn't happen yesterday, it's difficult to get care. But there's some things that we can still do there.
Okay. Yeah, it's not just concierge doctor, any doctor.
Yes.
Any doctor you can talk to, your family medicine doctor, your internist, your OBGYN, and let them know. Women should feel free and not ashamed to let their doctors know that, hey, I'm having problems wetting myself, or I can't hold my urine, and any doctor should be able to assist to get them some help. Okay, no matter what their insurance is, or even if they don't have insurance, because that's a medical condition. Okay.
Oh, this has been a lot already. I knew when I met Tanya, I was like, oh, she gonna change my life. I'm like, oh my God, I'm getting a new vagina and everything. Okay. Right. Okay. Look, you're gonna have a lot of clients after I get through telling what we got going on. Okay. So my sister has lupus and fibromyalgia. And so we, of course, she just got married, and she didn't even want to really get married because she felt having those issues that she wasn't adequate enough, and telling him, I was like, girl, please. At this age, people want somebody they can trust, somebody pay bills, you know what I mean? I mean, he loves you. But, so she was like, I told her I was coming here. She was like, girl, if you hear something that can help me, let me know. And so I didn't know if y'all have any clients or anybody with lupus or those issues where they are tired a lot or in pain,
So most of my clients are clients because they have health issues. So they're coming to me for the holistic side of things. Detoxification would be the first thing that she needs to do. Lupus is an autoimmune disease, so a lot of times people want to skip detoxification. That is the start of everything. I don't care if you're talking about weight loss, health issues, sex issues. I don't care what it is. You want to get pregnant, detoxification. Everybody, this is the rule of thumb, everyone should be detoxifying their bodies 4 times out of the year as the seasons change. Easy. That is a way that you can remember that you need an internal oil change. You go get an oil change on your car. You get a tune-up on your car. We do everything for our cars and all that jazz. It's the same thing with your body. Detoxification comes first. It's your internal cleansing. You're cleansing your pipes, your colon, your kidneys, your liver. That's what you need to tell her. If she has not incorporated detoxification in her lifestyle, she needs to start today. This is a raw juice tonic for menopause and female womb and vaginal cases. I do a lot of clients who have other health issues. If you're not following, go to I am Barbie Jones. If she's on Instagram, you can send her to me. I juice for her specific needs. So, for example, like you just said, lupus, I will tell her everything I just said, and we go by her needs. So I'll ask her, are you on any medications? What are you eating? When the last time you pooped? It's the whole 9. So it's not a cookie cutter system. It is catered to your needs. So she was asking about samples or examples of detoxification. It is so many in the world that we live in. If you Google, if you put detox in, you're going to be overwhelmed. A general detoxification is like the Daniel fast. If you guys are, in your church, you'll hear about the Daniel fast. That's the most simplest, easy where you can start now. So it's pretty much you are taking out or cleaning up your diet first. So you're taking out processed foods, you're taking out red dyes, you're taking out anything that is fast food or microwave. You're eating it whole, it's whole foods. So we are so accustomed to like every corner has fast food. Some people don't even know what whole foods are, okay? You wanna start there. You wanna take out white sugar. You wanna take out caffeine. That is a detox. It's an elimination process. Do not overwhelm yourself. If you know that you need to start somewhere, if you have white sugar in your diet, that's the first thing you take out. You make it easy. You don't want to make it complicated. If you know that you have caffeine every single day, start there. Do not do cold turkey with caffeine. Your body's going to hate you and you're going to have headaches and withdrawals. So you can do a step down process. If you know that you are a Starbucks and Dunkin' Donuts person, every single day you're having caffeine, start with taking one day out. You see what I'm saying? If you are a person who eats processed foods, start having a balanced meal one day out of the week. So those are little things you can do that's going to start that detoxification process. If you have sodas that you like to drink, take it out one day out of the week. Do step down process.
What do you recommend for fibroids?
Me personally with raw juicing, so you're right. So you can do the raw juice. I have it in a half a gallon, a 3-day. Do a video. Half a gallon, or you can start with a 16 ounce. Also, my tea company, you can do herbal teas as a maintenance phase. It's so many options. Your diet is going to be key.
Do you have clients that have stomach issues that can't handle a lot of raw?
Say that again.
Do you have clients that have stomach issues that cannot handle a lot of raw?
Nobody should have stomach issues that can't handle raw. There's a problem there if you can't handle raw foods. You know, like sometimes you can't do like a whole big, just go strictly raw. But why are you having stomach issues? So people will say, oh, I'm lactose intolerant, or I have this issue and I have this problem, I have acid reflux. Why do you have those things? Those things are not normal for you to have like stomach issues. People just make it normal. Like, oh, I just have, a sensitive stomach. Why do you have a sensitive stomach? What does that mean? But for fibroids, you want to attack the diet because a lot of people go and have the surgeries, and within 3 to 5 years, guess what happens? Those fibroids return back. So with fibroids, you're either going to feed them or starve them. I make everything simple. So what are the things that feeds fibroids? Soy. So a lot of people will, take in soy and they'll say, well, I'm on a vegan diet. And I'm gonna tell you, the most hardest thing is to hear people say, well, I'm vegan. I took the chicken out and I did that. Most of the fake meats with the vegan community has soy. So you're still feeding the problem, right? You got caffeine. When people have fibroids and they are inflamed, caffeine is causing that inflammation, right? White sugar. Sugar is in everything. Sugar is in condiments, ketchup. You got to look at what you're eating. There's no way to avoid that. We got the young girls. They want to be weekend turn up. I want to go to the hookah bar and I'm drinking this and I'm drinking that. You contribute to your fibroid factor, right? Overconsumption of chicken. That was my problem. Chicken wings, lemon pepper, hot, 10-piece. We in the American deli with the blue cheese. Yeah. But you're trying to figure out why you have fibroids. Like that's overconsumption of chicken, which has a high amount of growth hormones. Okay, your dairy. People say, well, I don't drink cow's milk, but you love ice cream. You love mac and cheese. That's dairy. You're eating eggs. That's dairy. So a lot of people are uneducated what dairy is. Let's start there. Oh, I eat yogurt sometimes. That's dairy, right? So you're feeding your fibroids unknowingly. Sometimes people know that they're feeding the fibroids, sometimes they don't. So let's go a little bit deeper, okay? Your feminine hygiene products. Bleached pads, it's bleached, they're white, it's cotton, right? The water bottles, when it sits in your trunk in your car and it's hot, we're gonna go deep today. That right there, it leaches chemicals that feed in those fibroids. When we like the sew-ins and the braided hair and the relaxers, that contributes to fibroids. So it's not just a food factor, it's what we put on our skin. It's what our body's ingesting. Our body is a large organ. It takes in everything. You better know it. Everything that you put on your body, and you putting it on, lotion, perfumes, all of these things matter. Yeah. Eh, Things that are shipped over from China, things that are here in America, like like when we put it on the polyester, all of that matters. Your laundry detergent matters. Your hand sanitizer. Hand sanitizers during the pandemic, it was in stores everywhere we go. We putting on hand sanitizer. It's a chemical in hand sanitizer that contributes to fibroids. So these are things that people do not talk about. They don't address it. They don't even know. It's braiding hair. We're all sisters here, right? We're all black. Braiding hair, canker-line braiding hair contributes to our fibroids. Nobody talks about that. So you have to go deep and do your research. People just think it's a food factor. It's not just the food factor. It's an everything factor. So that's what I teach my clients when it comes to fibroids. They're like, oh, I didn't know that. Oh, we going deep. It's not a game.
So Barbie, what about the air? The air, because remember in Conyers they had this chemical fire.
Air is horrible. We should literally have air filters in our home. When we take a shower, you should have filters in your showers. We can't be perfect, but we can kind of cut down on some of those things. But it's real out here. It's so real. So people still use tampons. You're sticking something up that's not supposed to be there. They're just bleached. Yeah.
Barbie, and probably all of you all, because I think any of us are in here at menopause, the weight gain. And what's frustrating for me is I'm not perfect with my eating and all of that, but I do damn good. I do. I try to eat the right supplements and all the things that I know blood type, whatever, do pretty good. And in the past, Carly and I were talking about this earlier, some of the things that we used to do years ago when we worked out. Working out in the morning, working out in the afternoon, running on the Stairmaster, 30 seconds on, 30 seconds, all this kind of stuff. I can't do any of that anymore. So I figured out like the cardio and the weightlifting and all of it and the foods. But can you speak to why the menopause belly just keeps doing its own?
We just talked about that. I don't know if you
Again, is the lack of estrogen, and so a lot of times the adipose tissue, it it feeds off of estrogen, and that's why women, we tend to get more belly fat, hip fat, breast fat. That's where the estrogen tends to deposit. And when we're going through menopause, we don't have as much of that estrogen, but what we have is our metabolism slows down. And it's already where we have a tendency to have an abundance of the fatty tissue in those areas, the abdomen, the hips, the butt, and so it is harder for us to lose that. And yes, we are just predisposed, a lot of us women, because that's our shape, that's our composition. And so what I do recommend, like you said, you're doing the right as far as eating, you're doing the right as far as cardio. And cardio, by the way, ladies, is extremely important with all women, because heart disease is the #1 killer of women. So we have to incorporate cardio, okay? In addition, of course, to weights, because weights, we need that for our muscle building, to decrease our risk for osteoporosis, breaking hips, bones, and so forth. But cardio is extremely important for our increasing our metabolism and for our heart. But yes, it's frustrating with the. Yes. And you do have to be careful, like Barbie said too, with even people who say, okay, I'm vegan, I'm eating just raw vegetables and so forth, but some of the raw vegetables are phytoestrogens, so they have natural estrogen, so you have to be aware of that as well. they're good for if we're going through menopause and we need to replace some of that estrogen. Those okay, but you have to be mindful that it still is a natural estrogen and is going to contribute to the deposition of fat to the abdominal area, the hips, the buttocks. I know.
I was speaking earlier, and they were talking about menopause, some of the ladies at the conference, and Maria Moore gave a great point of her with working with her clients, and she said that she was not a fan of GLP-1s, which is like the semaglutides and the Wegovys and all of those other peptides that are available. And she said she used to feel like that was like a easy way out of losing weight. She said she used to feel like if you could just diet and exercise, you would be fine. But what she's found, even with working with clients, is that the GLP-1 has actually helped so many women who are experiencing menopause to actually cut some of the cravings, but to also help and aid in the weight loss or maintaining the weight, or help with if you're experiencing the weight gain, belly fat, and things like that. So I do think it's something like, as we continue to age, to look at what's available to us. And maybe we get the education that says, well, it's not a quick fix. I'm doing everything I'm supposed to do. I'm eating right. I'm working out. But considering other options that will just aid in our own rescue. So I think like even considering like a GLP-1, even if you microdose it, I'm sure would be extremely helpful as women continue to age.
It's fine. It's okay. It's fine. So I've been going through my menopause journey since May of this year. I started perimenopause when I was 44. Cycle stopped, everything.
Oh, wow.
And so May of this year, full-fledged menopause. I have been to therapists, specialists, therapists. I have 2 therapists, actually. However, I did something. Went to the vitamin lady. She gave me, she did my blood work, and she gave me triggers for this, put me on a 30-day detox. That helped somewhat, but I think that menopause is for your own self. I have talked to so many women, and they gave me their symptoms, and then I compared them to my symptoms. But this journey is for me. I had to sit my husband down, and I gave him 22 of the 44 symptoms that I found online. And I told him, I had to sit him, and I'm like, I understand that I want to divorce you in 1 hour, then cry another minute, and then want to marry you. You know, it's just, it's just a whirlwind. Can you guys talk a little bit about fasting? I did a 24-hour fast, and this is me. It was okay because I do intermittent fasting anyway, so it was okay until that 12th to 14th hour. I don't even have a KFC even by my house. I started smelling KFC. All of my senses started just flowing because my body was not used to a 24-hour fast. So when I got to the 24-hour, and I'm like, I was telling my husband, Willie, I need something to eat. Just put a peppermint in my mouth, just something. And he's like, no, you can do it. I'm like, can you do it with me? I'm like, no, you can do it. And when I did, I accomplished something. But I felt so refreshed. I went to the restroom. I don't have a problem going. I do a lot of exercise and I do lifting. And that wasn't a problem, but it's like a reset. It was a real reset. So can you just give some more information about fasting? We do have a young lady at our gym called, her name is Rejoice. Rejoice did a 5-day fasting. Amazing. She went 5 days. I did 24 hours, but she did. But I want to get to that point.
With just water?
I think it was just water. Just water, yeah. So can you guys just talk about the fasting and the benefits?
So fasting that's a general statement when you say fasting. Some people do extreme fasting, like some of my clients are on 30 days of raw juicing, fasting, 60 days, 90 days, depends on what you're trying to accomplish. A lot of people fast when there's an illness present, cancer, high blood pressure, diabetes. So they're doing it to reverse some things. Now, again, everyone should be detoxifying. Fasting is a form of detoxification 4 times out of the year, so you can choose what works for you. Water fasting is superior. So the first tier is dry fasting, where you go without anything, right? Second, water fasting. You drop down to raw juice fasting, and so on. Daniel fast is at the very bottom because it's like it's like a beginner's phase. But there's so many different ways to fast. Fasting is in every religion, every single religion. There's a fasting portion, but fasting heals the body. It regenerates your cells. Intermittent fasting is wonderful. You can start there. Water fasting is the hardest thing to do. Master cleanse. A lot of you may have heard of the master cleanse. It's not a game. It's the cayenne pepper, the one that Beyonce became popular when she did the, right. So where you're doing just the cayenne pepper, the lemon, the syrup, the maple syrup. And some people do that for weight loss. But fasting it can be free, but it's the quickest way for you to heal your body. I'm a believer in fasting on all stages, okay? And you do have to be careful when you're fasting. So if you're diabetic, you can't just jump into fasting. You do have to get your doctor's consent to do certain types of fasting, but everyone should incorporate fasting or detoxification somewhere.
What's your thoughts on like okra water and aloe vera juice? Aloe water.
I am an aloe queen. I don't juice without raw aloe vera, and that means taking the whole plant leaf, cutting it open, going in the middle, and incorporating into raw juicing. It's a game changer. Everybody can't stomach slimy things. It's up to you. Okra water is, it's okay. It's hard to get down. Again, if you don't like slimy things going down, but it's a natural lubrication option internally. Again, coconut water, aloe vera juice is another one. So you got your external lubrication and you have internal. I believe in both. Okay. I'm gonna always go with coconut water over H2O. It's a game changer. Straight up, y'all, for real. Yeah, you get your young coconut, and I ain't talking about the bottled coconut. Yeah, like a real coconut that's $2 or $3 at the farmer's market. I don't believe in drinking things from bottles because it's some process that go into that. That's just me. I want to get it right from the source, and within 1 to 2 days, you're gonna notice really quick.
So just do coconut water.
Yeah, your skin, your hair, everything, your hydration down there. Get you some. Yes. Say what now?
So like the coconut that you got to
Yeah, like the green young coconut. Listen, you can go to the no. Go to the farmer's market. They got the new kind where it's got a little thing on it, and you flip it upside down, and you just slam it on like a countertop. Stick your straw in, and you drink it. So you don't have to have the tools like back in the day, like the Jamaicans, you cutting with a machete. You don't have to do that. But coconut water. And your second source, if you can't get an actual young coconut, then by all means go with the bottle. But I'm just weird about like coconut water being in a bottle. That's just me. Yeah, it's like $3. Yes. But the okra water is the business too. I just can't.
So I am a 12-year stroke survivor, and in my 40s, of course, when I had the mini stroke, of course, a TIA is what it's called. And so when I had that in my 40s, my neurologist was saying that, well, let me just tell you guys a quick story. So what happened was I was working out every day. I had just ran 4 miles, everything. My legs, I thought my potassium was low. Just ran, like I said, 4 miles. And the next day I was like, I'm not gonna go work out. But something kept saying, go work out, go work out. So I went to go work out with my personal trainer that particular day. And I had a stroke in front of the entire class because she kept calling my name, and she said I was looking around the room and she could see the entire side of my left side had drooped down. So I was having a mini stroke at that particular time. Thankfully, she was a registered nurse, so she knew what to do. So I had a full recovery, and all of this transpired because when the young lady asked about the fibroids, I was suffering with the fibroids. I was bleeding, clotting a lot. And so I was on a birth control pill called microgestin. And I should have not been on that because, like you said, I had health issue with my blood pressure was high, cholesterol was high. Of course, I'm gonna just be honest, I was eating Popeyes and KFC. I thought because I was working out that I could eat whatever. The working out saved my life because of the fact that, that's what I was doing every day. I only lost 1% of oxygen from my brain, so I had a full recovery. When I tell you I am a survivor, people do not understand my story. But the reason that I'm asking this is because my neurologist was telling me back in April when I went to go see her, she was like, Cassandra, you can't go back to how you used to eat. You still have to eat. Like, they put me on a 15 to 2,000 sodium low diet. And when I tell you guys, I lost like 36 pounds. I went from a size 10 to a size 2. I don't want to do a 2 anymore. I'm going to just be honest with you because I was looking like a little bobblehead. However, my numbers were so intact. But now that I'm in menopause, and as soon as I hit 50 in 2020, it's just like I started gaining weight. I was doing this, I was doing that. So my question is, I cannot take any hormone replacements or anything because I'm on a baby aspirin every day. I have to take that. So I have to be very particular in what I take. So everything else that everybody else is doing for menopause, I can't. But I was told that I need to eat more fiber, like you said, coconut water. But I want to figure out what are the things that I can eat daily so I can get all the fiber, the nutrients, and all of that because, hey, I'm a living testimony. And I say I'm going to live. I'm not going to die. I'm going to have a long, healthy, debt and stress-free life. And so I'm going to be here to do that. But I know I have to do my part. And my part is I need to find out some of the things that you were talking about that I could probably incorporate into my diet daily.
First of all, I'm doing the math on your numbers and your age. I'm like, wait a minute, hold on. Wait. One time for those jeans.
Yes. I'm going to. September 26th, I will be 55 years of age.
Come on now. Oh. Beautiful. I like smoothies. For fiber, I like to get fiber through smoothies. It's easy, it's quick, it's something you can do in the morning. All of your greens, your kales, your roughage, that's what I do. Like if you just really think about whole foods, you cannot go wrong with that. I don't complicate anything. You're just gonna eat whole foods. Just think about your diet every single day. And a lot of people don't have time, so that's why I go to smoothies because it's quick. It's something you can put whole into your blender. So in your case, you won't do a lot of raw juicing because you're pulling all that fiber out. You want all your fiber in. So apples, people forget simply eating an apple. Yeah. It's fiber. And people,
apple a day keeps the doctor away.
Yes. Like simple things. You got to simplify. Our lives are so complicated. There's so much going on. Simplify that part. A simple red apple. People are like, that's it. Eat your apple. Yes. Eat apple. Apple day. That's, what do you say? Keep the doctor away. But that's so much fiber. Just incorporating apples in your berries and like whole fruits and vegetables. We do too much.
And that's what I said. Yeah. Because I remember when you came to me. Rossi came to me one day, and remember you told me to eat. What was that you told me to take? No, it was something you told me to take at the gym that's to help with the bloating to go down. I cannot think of, but I can't. Flaxseed.
Yeah. So flaxseed.
But I can't take it because I'm on the baby aspirin. Because when I took it for a couple of days, I took it. every other day. Guess what? It did something with the baby aspirin. It threw.
It counteracted with the
Yes. So that's why I said I have to be very careful. Yes, and I'm on the blood thinner, so I couldn't. Yeah, so I did. No, it's a.
Yeah, yeah.
Understand a lot of natural stuff are already
Exactly.
they already blood thinners.
Exactly.
Yeah.
I have had a
You didn't know.
twice.
No,
Twice,
it's okay.
really?
And so I reached. Of course, Dr. Belinda used to be my doctor, but she referred me to someone else because she already know why. Because we want her to come back. We want her to come back to the light because I know I could always reach out to her to kind of ask, can I use? So I called my neurologist. She was like, no, you can't. You can't take it because the days that I didn't take it, I felt fine. And when I put it in my smoothie, I kept saying, I'm feeling weird. Even the same thing with me getting an IV. Lindsay gave me an IV a couple of weeks ago at the gym. Well, it's been about a month ago. And I kept saying, why am I feeling weird? I'm feeling crazy. So I asked Keita. I said, Keita, what is in the IVs that I'm getting that's throwing me, I'm feeling weird? She was like, it gotta be the B12. I can't take B12.
Right. Yeah.
I can't. So when Lindsay gave me an IV the last time, I said, take the B12 out. I was fine.
Right.
So I have to make sure that I check to see because I'm taking this baby aspirin daily.
That brings the point. Like I have a lot of patients that tell me, I get like IVs and so forth. You do have to really be careful about what you are getting.
Yes.
And a lot of times when they get the IVs, they're not getting tested to see what their levels are first. So then, they have way too much B12 or whatever it is that they're getting. So you really do need to be careful about getting the liquid IVs. Yes.
And so the young lady, like I said, who saved my life was Crystal's line sister, which was Tasha, at Tada's Fitness, because she's a registered nurse. She knows my history. Like she knows my blood pressure. She knows what's going to work for me, what's not going to work. And so I do have to be very careful to make sure that everybody not going to know your medical history like that. So, I and that's what my neurologist was saying. She was like, you can't take what the average person take. And my body has changed from when I first had a mini stroke until my age now. And she was like, things start deteriorating. And she was like, you have to really be careful. So that's why she was like, when you said that about, we'll test and take the car to, get an oil change and everything. So I'm starting over now because I got to help I got to help Cassandra to make sure I'm going to be here a long time. And I'm going to make sure I do my part.
Right.
Yeah.
Exactly.
And Keita is a registered nurse. Everybody that she said was
Yes.
You just saying their name.
Yeah. Oh, yeah. Everybody. Oh, yeah. Keita and Lindsay are both registered nurses.
Right. Yes. Yes.
Yes.
Okay, hi. So I'm kind of bringing it back to when you were talking about fasting. So I think one of the things that doesn't get talked about a lot is what do you eat when you break your fast? Because I think a lot of people fast and then they just think, ooh, I didn't have bacon or I didn't have, whatever. So what
That's
do you eat?
probably the worst thing you can do is go on a fasting protocol. And as soon as you get off of, you go back to your regular scheduled program of eating trash. You cannot do that. Your body will literally go into shock. So again, actually, let's go back. Prior to going on a fast, your diet should be taking certain things out in the first place in order to you to get maximum results. So you can't be eating chicken and ho-ho cakes or whatever, and then tomorrow you're like, oh, I'm finna go on this fast. No, you're not. No, you're not. You're going to feel like trash. So, again, caffeine is probably the biggest thing that you should come off of because when you start this fast, the withdrawal symptoms, you're going to be like, oh, this is not a game. You're going to have headaches. You're going to be irritable. Nobody's going to want to be around you. Your attitude is going to suck because you'll be like, where's my caffeine? Caffeine is the most addictive thing. So when you come off of it, you feel like crap. Your body aches. So I always tell people, elimination diet, no, let's go back some more. 2 to 3 days prior to your detox, there should be no sugar, no processed food, no snack foods, no caffeine. So you're trying to get it all, some of the stuff out before you start this fasting protocol. Then when you come off of it, you got to do the same thing. So you're putting things slowly back in. The first thing people want to do is like, oh, okay, I can have my glass of wine. I can have, no, you can't. You just screwed up all the stuff you just did.
And then the other thing is when you were talking about coconut water, so I do that. I go to the farmer's market and I have them juice it and I get a quart or whatever
It's the best thing.
But I find that it goes bad after about 2 days.
You
so
know
I've
what?
started freezing it.
Yeah, you can freeze
So
it.
does that change
No.
the value of it?
So people, everything raw will go bad fast, right? That's a great thing.
Yes.
When you have something and then you can put it on your shelf in the kitchen and that thing ain't going bad, get rid of it. It's heavily chemical processed. I tell people like this, when you bite an apple, you sit it down, you see how brown it turns, oxidation. That's a great thing. When your fruit is not turning brown, get away from it. You can have a McDonald's sandwich and sit it on your kitchen counter. I promise you, 2 months, it's going to still be the same. That's not good, y'all. So, yes, fruits and vegetables go bad. We all got the kale looking at us like every time we open the refrigerator, she gonna just keep seeing us in it, and it's gone bad. We can't even use it. You know what I'm saying? We all got that fruit, vegetables in there looking at us. So you can freeze coconut water. Yes, you can freeze raw juice and smoothies. You can freeze it up to 6 months. And it still has, when you unthaw it, just shake it up. Enzymes, remember this is very important. Enzymes is what fuels the cells. This is what heals the body. So natural enzymes is in raw fruits and vegetables. When you cook it, the enzymes are gone.
One more quick question about that. Sorry.
Go ahead.
What about oxalates, like in raw spinach and kale? I hear a lot of talk about oxalates in your
So
liver
you got to be careful with your greens. Again, this goes back to what you were saying. It's not a one-size-fits-all. If you have a thyroid issue, under or overactive, you can't have kale. People love kale. It became so popular. And so your doctors will be like, okay, yeah, you can have a little bit of kale, but what's a little bit of kale? So if you're having thyroid issues, you're having issues with, you can't lose weight, start looking at your thyroid function. Kale is something that would trigger, and it's not a good thing for you, right? Autoimmune disease, she can't have tomatoes. It's certain things that if you got a health issue, you cannot have even if it's healthy. This is why my clients come from states wide, they flying in, because I juice according to what your health issue is. Not a one-size-fits-all. We go into like these juice bars and smoothie bars, and we see a menu. We're like, oh, I want that. Can you have that? What kind of prescription drugs you're on? You know I juice for you. It is not a game. Okay? High blood pressure. You can't have certain fruits or vegetables. We think just because it's a fruits or vegetables, it's good. High blood pressure, you cannot have turmeric. Did you know that? Yeah. It's certain things. Yeah, if you have these health issues, if you're diabetic, you can't have certain fruits in your juice. So juicing became popular, and everybody on the corner juicing. I just be looking at them like, okay, you play with it if you want to, the wrong way, and you can cause more harm than good.
You want to make sure too that you have, blood work, making sure your kidneys are functioning normally, your liver and so forth like that. And you can get potassium in foods, like natural foods, fruit, bananas, potatoes, you can get natural potassium in what you eat a lot. Okay, so you do have to. So if you take a diuretic, you're going to lose potassium because you're urinating out more. So when you urinate more, you lose your potassium. So that may be why your potassium is low. Okay, but again, we have to be careful about the natural foods that we eat, especially if you have any conditions, if you have diabetes, if you have high blood pressure, if you have thyroid issues, because certain natural foods will counter what your condition is and make it worse. So,
This your tea too? I don't want everything at a tea. I didn't get the detox. That's okay. No, but they ain't tell me. I'm gonna get back down.
You ain't getting juice while it's here because you ain't gonna be able to get it. Please, baby. You gotta get it here. Baby, this like the exclusive
Oh
club.
no, that's why I got all my stuff. I knew
You ain't gonna get that juice with you. Like, all right, I will see you in 6 months. With my client is free, so I will see you in 9 months. 2026, I got it.
When she supposed to say, y'all go ahead and pay right now.
Yeah.
And if you don't pay within a certain amount of time, this slide is gone. And she's not playing.
make sure you tell her your medical conditions too, so she knows the right juice
One thing
for
about it,
you.
she's gonna ask. And she's not gonna play with you. She's gonna ask you your medical conditions and everything else. You're gonna have to get her the full download.
Right.
Play with that, and so people don't understand. Like they just be like, "Yeah, I went inside the juice bar and I got this and I got that," and I'm like, "Y'all are playing games with y'all else. It's not that simple. It's not a one size fit all."
It's not.
Lord, I don't know if I'm gonna be able to sleep tonight. That's about all this stuff.
Yes, a lot.
So I have two questions, one for you, Dr. Belinda, and one for you, Barbie. I guess I'll start with the fasting. If I wanted to start doing like the water fasting, how do you recommend? Do you recommend 3 days?
Well, the question to you is, are you new to fasting?
So I fasted like years ago, and I haven't done it recently.
Then you won't do a water fast.
Don't do the water fast.
No, because you're not ready for a water. People who are ready for a water fast are not new to fasting. Dry fast and water fast, they're at the very top. So if you haven't fasted in a while, I would say first start with intermediate fast. We have to warm ourselves up. We can't just be like, I'm finna just.
So I think I intermediate fast.
You said it again.
Like I don't intentionally do it, but my body does it.
Yeah, so I would start there, and then I would go into like a raw juice fast.
Oh, okay.
Yeah, and that's easy. You don't have to go out here paying people to raw juice fast. And people say that to me all the time. You tell people that, yes, because you can get you a juicer and you can do a juice prep.
And how many days you think you should do for the raw
I
juice?
start minimum at 3 days.
3 days. Okay.
Yeah, that's a beginner's fast. Now, once you get past that 3 days, you're feeling good, you're okay, your level's okay, your blood sugar's not spiking, then you can go further. But you got to know your body and make sure that you are, safely doing it. Because people just really be playing games out here with this fasting, and you can't do that. So I would say start with your intermediate fasting, drop down the second week, you can go into like a minimum of 3 days and see how you feel.
So when you do it with the juice, you just do it anytime you feel like you want to?
No.
Okay.
You're going to do at least 4 16 ounces of raw juice per day. That's the minimum, 64 ounces. You can go more. You can't go less. Your body needs to constantly get that raw juice in there. You don't ever want to get hungry on a juice fast. That's where most people go wrong, and they be like, I ain't doing it. I'm finna quit because I'm hungry. You don't allow yourself to get hungry. So that's where you're making sure you're juicing consistently throughout the day. As soon as you take a break somewhere in there, your mind is like telling your stomach, I'm hungry now. People don't really be hungry. They miss the chewing process. You be like, I'm supposed to be chewing right now.
Oral fixation.
So you just want to make sure you have enough juice. Not enough juice can actually do more harm than good.
Okay. And then Dr. Belinda, we have, so all of us pretty much work out at the gym, right? So I've heard a lot of people discuss like, oh, you shouldn't work out so much because that's what's giving you the belly fat, and they talk about cortisol, and they said like after a certain age, some people are saying when they're going through menopause, they shouldn't do the workout that we do. Like, what's the deal on that?
No, I tend to disagree with that because, like I said earlier, we need the cardio workout. We need that for our heart. When we do cardio exercise, it increases the HDL, which is the good cholesterol, and lowers the LDL, which is the bad cholesterol. And after menopause, your cholesterol tends to go up anyway because we don't have the estrogen to protect us. So we want to get the cardio in. Now, you don't want to hurt yourself. You don't want to get injured or anything like that. But if you feel good when you exercise, then it's great. Yeah, you want to feel good. So if you're not having any negative effects from it, then it's fine. You have to listen to your body. Listen to your body. And if your body is saying, yes, I like this, this is good for me, then there's no problem with that. Yes.
Tanya?
This is for you, Bobby.
Yeah. You can, but you have to consult with your doctor first. That is the correct way to do it. Again, people don't consult with their doctor. They're just nilly-willy just doing it. You can really hurt yourself doing that. Because, truthfully, when you're fasting, you should not be still taking prescription meds. So that's where the doctor comes in and say, hey, do you advise me to fast? Most doctors will say no. You know?
A lot of times you have to take your medicine.
Right. So fasting and taking prescription meds, they kind of clash because your fasting is a healing process. So your body's confused like, okay, she's fasting, we're healing, but you're putting this foreign chemical drug inside me. Yeah.
Right.
So with that point, if you do decide to fast, you have to monitor your blood pressure. Like she said, you do have to talk with your physician first to make sure it's safe for you to do that, okay? Because you don't want to stop everything and then your blood pressure spike and, then you have something go wrong. So you want to make sure.
Yeah, I have a question about fibroids. So I personally suffered with fibroids for years. This was, of course, before menopause. And I finally got some help. I ended up having the uterine fibroid embolization. And that was something that I really hadn't heard a lot about, especially from my mother, my grandmother, my aunts. So I think it was a newer technology, but fibroids was difficult, really difficult to deal with. I personally had a cycle that lasted 18 days a month. 18 days a month. Yeah, and then I started having cramps. I was going to the store to get Midol. I see all the teenagers in the aisle getting pampered in Midol, and I'm there with them too, just to get medicine for cramps. So I had my uterine fibroid embolization, and it was hard for the very first week, for the recovery piece. It felt like I was dying. But after that, things got better. My stomach went down. You all remember me when I had that big old stomach, right? Y'all say you do. Yes, you do. Some of it was fat. Some of it was fat, but most of it was because of fibroids. Yes, frequent urination. I still go to the restroom a lot now, but it was worse back then. So fibroids, I've read something somewhere that said by the age of 50, 80% of women have fibroids. Is that true?
Very common, extremely common. Yes.
Very common.
It is more common in African American women. Yes, very common.
Why is that? Do you know?
Again, I think it's because of our diet. I think it's because of what we eat. And so, yeah, that has a lot to do with it.
Something on fibroids.
So I think that's a great question as to why do Black women tend to develop fibroids more than our non-Black counterparts, I guess. How much time we got? But one thing I realize is that oftentimes Black women don't like to have the conversation, but we are naturally voluptuous beings by nature. We can't help it. So what happens is we tend to have more estrogen, and when estrogen processes, it stores in our fat cells. So we tend to develop fibroids more, but also from a environmental standpoint, right? All of the external stressors on a job, in our relationships, in our household, so stress and anxiety tremendously develops fibroids. They really impact it, and I can speak firsthand. And other things that Barbie was talking about is the endocrine disruptors with all the chemicals, our hair products. But one thing that you kind of touched on is all the plug-ins. We do all these plug-ins and candles, and they could be soy candles and all that. All those are considered endocrine disruptors, and it helps to contribute to the fibroids. So you have to be very cognizant of what you're feeding to your body to make sure that you're not inadvertently, contributing to fibroids. But yes, 26 million women in the United States alone actually suffer from uterine fibroids, just in the United States alone. And Black women, we are 3 times more disproportionately susceptible to uterine fibroids. So that would be the reason why. But sometimes Black women don't like to have the conversation about us and our weight, but that is a fact. It's science, so. I guess so. Hi, everybody. Hey, Roxy. I'm LaToya Dwight. I'm the founder of the Fibroid Pandemic. And I started my organization based on my own personal tumultuous journey with uterine fibroids. I turned my pain into passion. And so what I do is to help, actually I tell women about things like this. I'm not the plug. I don't provide, I'm not the resource, I'm the plug. So I tell people about you.
I think I follow you. I think we follow each other.
I think so.
Yeah.
But, another shameless plug? Since you're telling me, yeah. I was trying to be quiet, y'all, but since you're going to, so.
No gatekeeping.
Right. So as I mentioned, I turned my pain into passion, and I'm taking it to the pavement. So I am the curator of what's called the Run FAR 5K. FAR is an acronym, it's a double entendre. FAR is an acronym for Fibroid Awareness and Resources. But it also stands for FAR as in going the extra mile with you, to lock arms with you to help you across that finish line of your fibroid healing journey. Mm-hmm. And my 4th annual 5K is happening next Saturday. I wasn't gonna say nothing because I wasn't here for that. I'm here to learn. Because Lord knows these hot flashes they should be illegal. But 4th annual 5K, I'm bringing it to the city. It's gonna be at Grant Park, 8 a.m. And my goal is to make sure that when God calls my number, I leave empty.
Come on now.
Because our women don't know which way to turn. People don't even know about UFE. There's no reason why they should not. It's not a one-size-fits-all. But what the fibroid pandemic does, what we do is we don't promote one resource over another. We promote education. Educate yourself so you can decide what works best for you, what works best for you, what works best for you. Because like I said, when God called my number home, I ain't got no excuse as to why I can't get through those pearly gates. He could talk about my potty mouth every now and then, however, so back to your point, that's the reason why Black women get fibroids, more susceptible.
Yes, thank you for providing that. Yes, ma'am. And one thing we haven't talked about is stretch mobility. Yeah. We haven't. So, we often complain about aches, pains, joint pains, and all of that type of stuff. So how can stretch mobility help us to ease some of the pain as we journey through menopause?
So moving is number one. So we talked about weightlifting, cardio, all the things. But what made me decide to do a panel like such is because I'm seeing 35, 40-year-olds come into the studio saying, my hip hurt, my such and such hurts. And I'm just like, how old are you? And now that I'm seeing them 35 with deep hip pain and low back pain, and really, really, I had a 35-year-old told me she had to get a cane because her hips hurt so bad. She had a cane. I was like, what? So the mobility, the fact that that is a part of what's being commonly seen as it shows up in the studio, that the aches and the pains, they're just insidious. They just show up. They have no trauma prior to. They just come and they just show up. And so with that being said, I like to say that that's some hormonal imbalances. And so I created this program that helped people understand that how do you, first things first, how do you eat? If you have hormone imbalances in your body, it's already a fiery activity going on in your body, and then you go eat chicken that has growth hormones, you're adding that lighter fluid to the fire. So helping you understand how to eat will bring on those reliefs of certain symptoms that you experience in menopause. So move. If you sit there, you decay. You sit still, you decay. You gotta move. It's not something of choice. It's something that you have to do. Yeah, so that's what brought me to help others understand when we had our period, we can talk to our sister, or we can talk to our aunt, and we can talk to our moms. But who do we talk to when it comes to menopause? Everybody got hysterectomies. As our mothers and our grandmothers, their answer was hysterectomy. So they're not really giving us pointers and directions on how to handle menopause. This is something brand new to our community, and we deserve to know how to fix it. We deserve that. We wear a lot of hats, and we got a lot of responsibilities. And I read something just recently about how women are of this age, of our Gen X, where they're calling us sandwiches, because not only are we handling fibroids, turn around and handle the fibroids, now we got menopause, then we got to take care of our parents, then we got these kids that ain't out of our house yet. We're called sandwiches. So we have a lot of things on our plate right now. So we need to know how to manage, how to master our menopause. Yeah. Okay. Okay.
And I feel better already, to be honest. And but I started going to acupuncture, and the woman was talking about my cheek too high. I said, well, girl, how we get it down? And so, I did the acupuncture. Kim worked with me, so I been to all this. She had me too chill. I'll just be relaxed. Girl, I ain't got time to be relaxed. You want to say that? Yeah, I think they want me to chill, but I mean, it was just like, I just felt like, I was with my mama and didn't even have nothing to say about nothing she said. And my son was like, Ma, you ain't even say nothing to my grandma when she said.
But what's wrong with that? What's wrong with being chill? Because we're a high functioning people that we stay. We're a highly stimulated group.
Yeah. And so I think, but it was just like I don't know. Number one, I did not feel myself.
Mm-hmm.
I was like, I don't know if it was something in the needles or what was going on, but it was just a little too much for me.
You have not been there before, right? You had just not been there before. Black women are the most overly stimulated gender on this earth. So you've not been there before. So you're always running. You got your kids. You got your businesses. You got all those things going. So that was foreign to you. That was foreign. Mm-hmm.
It was just like I was a different person, to the point that it was like, and because you feel like you need to have some type of edge to get. Girl, I ain't even had no edge.
And that's okay. And that's okay.
And I'm in like, I'm in construction and energy and all. And it's like, when you're dealing with men all the time, you can't be, okay. You know what I mean?
And I think this is just what we need to look at, even when we're in relationships with others, but also with ourselves. Sometimes we can revert to what feels familiar, and chaos can feel so familiar to us. because we are so used to doing, running, being all the things for everyone else. And so when we actually get time to like calm down, chill, to actually take time to find out what brings us joy, what brings us pleasure, it seems foreign. So now you're like, well, I needed something. I needed a little more because I was just too chill. Well, the goal is peace. You know, the goal is always for us to be able to rest in some level of peace. And so when we get to just calm down, number one, when we calm down, we get to find out who we are. And so sometimes we allow the noise and the chaos to disrupt us. And so we really don't know who we are, what we like, what's going on. We're just going from thing to thing, duty to duty, obligation to obligation. And so when we don't get a chance, I think the acupuncture is really good for you. You know, maybe your chi is high and you bring in it, whatever the yin and the yang, baby. But whatever you're working on, I think it's going to be really good. So now you're doing Pilates for 2 weeks. Maybe think of like a meditation practice or a yoga, another thing that can say, I'm really focused on me and how I'm showing up in the world.
Because one thing she did say was in Eastern medicine, she said in the East, power is quiet.
Yeah.
In the West, power is loud.
Yeah.
She said you need to be powerful from the inside. And one thing about time, which when I started with her, I was like, she always asked me, how you doing? I was like, why she ask me how I'm doing all the time? Because, but what I realized is, I was like, girl, I don't know. I'm here. It's like I'm here. Because I don't even think about how I'm doing. And so then, but then so my sister said, because she really want to know how you doing. But I was like, I didn't know if it was like since I was just working out like for the first time with Pilates. But it's like I realized after about the 5th day, you was like, you really want to know. How am I doing for me to be in tune with myself? Yes. And so, I mean, she even to this day, she'll text you, how are you? I was like, I think I'm fine.
But I think that's like a deeper point of like so many women don't get the opportunity to be asked and they get to actually verbalize how they're doing, how they're feeling. No one's asking them that. And so when we're looking at how we're showing up in the world, we're just doers. Instead of being able to be when you in this soft girl era, as they all say now on the internet, everything's about a soft girl era. But it's hard for us to be in a soft girl era when we're single moms or we're running businesses or we're the complete breadwinner. We're taking care of aging parents. When all of those things are stacked against us, well, soft life doesn't seem very obtainable. But so when we get to be quiet and someone actually gets a chance to ask us, how do you feel? Then guess what? We get to dive deeper into ourselves. That's like even if you can't even have Tanya ask you, then how is a man going to ask you, how do you feel? How do I feel? How does this feel? And we can't really answer it. So we have to be able to take the time to actually have communion with ourselves in order for us to really feel the fullness of what God has for us. And so sometimes that is quiet. Sometimes it may feel loud, but it's actually taking the time to actually figure out what you like, what you want, what you desire, but actually really embracing the fact that people really do love and care about you. And that's just yes, but that's how do you receive love? Yes.
And it took me a minute, didn't it? And so I was like, because you know, I'm in Lord. So she said, do you need a hug? And I'm like, yeah, just some hugs, please.
But you know what? I get that hug, but you know what? I get so many women who say like it's very difficult for them to receive, whether it's pleasure, whether it's oral sex, whether it's anything, because they are not able to quiet down the noise to say, okay, this is something for me. I'm deserving of pleasure, not because I had to do something to earn it, but because I'm worthy of it because it's my birthright. And so oftentimes we feel like in this culture, especially as Black women, that we have to do something to earn it. Well, I have to work really hard, then I get to go on vacation. Then I have earned the vacation. Oh, if I work out, then I get to enjoy the piece of cake. I earned it. And so everything we do is on this merit system. But what happens when we just get to show up because of who we are? Because we are so deserving of that. And so I want you to take a deeper look to say, what do I believe I'm deserving of? what am I willing to receive? What love is there that is around me that I'm overlooking because I'm not aware of how I'm even able to open my arms to receive what God has for me.
All right, do we have any additional questions or comments? One in the back, hang on. All right, let's give him a hand, everybody.
So, my question, well, one, I've learned a lot. I am just a boy. Like, but with that being said, how can I, as a partner, friend, anything, be an adequate asset to someone who is coming into perimenopause? Whether that's just being accountable, understanding, supportive, whatever the case may be. And I would like to see what that take is from each of the panelists.
Oh, I had a mic, huh? I was like, wait a minute. I think basically what you just said, being open, being understanding, being that soft place to land is going to be the most important part of that. Asking how are you and really being intentional about listening and not just taking I'm fine as an answer. So a lot of times we're like, I'm fine, I'm good. I've mastered the I'm good. The thing I had to learn to master is that, I'm not okay. I think I need this from you. So being open to prying a little bit more and going a little deeper. So don't allow those surface level answers, but really just what you said, being there, being supportive, being a listening ear. And also sometimes we need to be like, hey, do you need a moment? Do you need to decompress? Because there's times where I'm up here and I don't realize I'm up here until my husband's like, hi, I think you need a moment. So just those little things like, hey, let's go walk in Piedmont Park. Let's go to Atlantic Station. Let's go do something out of the house. I think that's going to be important for you to actually really hear and see what your partner is saying without them actually verbalizing it to you.
That's good. Absolutely.
Yeah, I think what my piece to share is explore together. Because if you're going to go into something like Pilates now, go to Pilates with her. Go to whatever with her, because she's in a new space, she's in a new place, she got a new body. You go with her. Yeah, hold her hand and go with her.
So I always look at things. I love explore because I'm in the sex space. So definitely exploration is key. All right. So I always look at things as like rediscover, reimagine, reignite. And so when we get to discover what's new about our bodies and where we are, not who we were, and what once was, but what is. And so embracing the new way of being. And so that means asking questions. And so it might be a great activity, maybe if you want to ask your partner, like, what's something new about you that I don't know? Because we think that we know everything about our partners because we've been with them a long time. So like, well, I know all the stories he's gonna tell. He's been telling that story since 99, And so we think we know everything, but we're constantly evolving. We're constantly changing. So one thing you could say is like, what's one thing about you that I don't know, that I should know? What's one thing that you're into right now that maybe we haven't tried before? Something new that you want to get into that we can try as a couple? What is something, how would you redefine our relationship? If you could wave a magic wand, what's one thing you would change about your experience with me? And so I think is telling your partner all the great things that you love about them, complimenting that, but also saying like, I want to be with you, kind of reassuring and saying, I want to be with you, I want to love you, I want to nurture you. How can I do that? And allowing her to answer. So always having this, the idea of exploration and never giving up on that because we're constantly changing. So being able to embrace the changes and ask the questions.
One time for my nephew. That's my
Oh,
nephew
good
right there.
job, nephew. Good job.
Well, this is my whole my family. This is my baby sister, my oldest sister, that's my nephew. So So yeah, that's a good question. Coming from a man, that's a good question. I would say get her a juicer. Y'all know what I'm gonna say. Get her a juicer, explore new foods, and just center her around like wellness in the food aspect of things, nutrition, new fruits and vegetables, because there's so many. And so summertime is a great time to explore passion fruit. A lot of people don't even know what a passion fruit is or what it looks like.
That's true.
You get what I'm saying? We think it's like the 9-layer candy when we was growing up. That's not what that is. So, opening up a coconut, going to the farmer's market, seeing what a soursop it looks like, and just new things center around your nutrition. That's a game changer. So I say that.
That is absolutely, I agree with that. Also, just listening to her, like Carly said, our bodies are changing. Just ask, like, what can I do to help you feel more comfortable? What are the things that you like? What things that you don't like? Some women may have things that they used to like that they don't like anymore. So just be open to listening to her changes in her mind, her body, her spirit, and just be there to support her. That's the main thing. Whenever we're going through changes, we just want support.
Amen.
And grace.
Lots
support
of grace.
And grace.
Lots of grace. Lots of grace. Well, Tanya, I just want to thank you for putting on this event tonight. It was relevant. I wish we could. Can we do it again? Because I feel like we need more time, right? To dig a little bit deeper. So I want to thank all of our amazing panelists, Dr. B, Barbie, Carly, Dana, and Tanya. I also want to thank you for showing up for yourselves. So give yourselves a round of applause for being here. I want to thank all of our vendors tonight who are here. We have Regen RX. You're giving out free and complimentary B12 shots. Beautiful. Did you all know that? Awesome. We have Barbie, her detoxification juices, House of Tea. Dana has some gift bags for everyone here, and I have some gift bags as well from Preferred Fibroid Vascular Center. And now I'll just turn it over to Tanya. I know everyone feels informed, empowered, so I'll turn it over to Tanya.
Thank you, Kecia.
Kecia, you're our amazing host. Thank you. I knew
you.
we would get entertainment from you and education. Thank you.
Thanks everyone for showing up. I really appreciate you guys showing up. I would love to do this again. I would love to have you back. Bring a friend. Know that those people, even the husbands, the counterparts, need to. Nephew already showed us that they need to be here. Thank you, nephew. Thank you for that. Yes, I really appreciate you all coming out. I really appreciate my panelists. They were amazing. I figured that we created a nice puzzle here to put it together and make it a whole. And as I said, they are such good friends of mine anyway. So I feel like, reaching out and saying, hey girl, meet me at the place. Let's talk. So thank you, ladies. Thank you all for coming. Yes, and for coming, I need to let you know that I appreciate you. And we did briefly talk about how the air is such a thing that we need to take control of our air. If it's in our immediate space, we can do that, but we can't do anything about what's outside. We only can do what's good inside of our immediate space. So thanks to our friend Tanya and her non-for-profit program, we're giving our panelists air purifiers. Yay! Thank you, thank you. So everybody, all my panelists get a, yes, we get a very nice, very nice. So Tanya, you want to tell us about your non-for-profit? Tanya is y'all already know.
Yeah, and Kim is our program coordinator with Partners in Action for Healthy Living. We started out in urban agriculture. So we used to manage 25 community gardens in DeKalb County and teach in 200 DeKalb County schools. all the gardening curriculum. And then the pandemic happened. We actually received an award by the CDC and was in their museum for, we gave out like tons and tons of fresh food. So we grow to give. We don't, that's our only purpose of growing food is to give it away, not to, sell it. No shade to the people that sell it. And just going through the pandemic and how hard it was, we had people in line for food that had never needed, to be in line for food before. And some of the shame that came with that, and it was just really, really hard. And so in my other life, my for-profit life, I'm an electrical contractor and a manufacturer in clean tech. So I manufacture EV charging stations and battery storage. So being in that after the pandemic, I was like, I'm gonna marry the two. So now we've expanded Partners in Action for Healthy Living, and we focus on energy, water, food, and we just added wellness. So I was telling Ken, I was like, well, we gotta be well. We can't be talking about wellness. And so we are the program manager for Weatherize ATL for the city of Atlanta. So we weatherize homes. And what we realized is your home can make you sick. By, it's not just with lead paint, it's also not being properly sealed and, like I said, the air. So we partner with Mothers and Others for Clean Air. And I think they end up getting like maybe 5,000 of those. And we only, for our first batch, we only took 350. And then it was like, we gave 200 for our homeowners. And then it's like, we got to find some more people that need these air purifiers. They retail, when you look it up, for $3.99. They on sale, they can get down to $3.49. But, because I was like, we can't be giving our people no junk. Because because sometimes when people are giving, especially our communities things, sometimes it's either low budget or discontinued, and we on a whole nother level. We don't even take stuff like that. So you're really gonna like it. I mean, I think it purifies up to maybe 5,000 square feet. It's a pretty strong one. It's a pretty strong one. So I do have one little survey I need y'all to fill out for it. And the good thing is, in 6 months, they send you a free filter. And then after that, they say you on your own. But to be honest, we got a little money. We can get y'all a filter if y'all need one. But yeah, so if anybody, is it okay to offer them one? Oh, so if y'all want one, we gonna be at the Adams. Where we gonna be tomorrow? Tomorrow. Yeah, 12:30 to 3:30, and we got some more stuff coming too. But thank you, thank you, thank you, Tanya.
Did you want to talk to them about the solar?
Oh, child, we got some. Y'all, I apologize. So yeah, I forgot. We got solar too. So we are the program manager for Solar for All too, where we'll be installing solar on, for solar panels. Yeah, I'm glad you. I be having so much going on. Half the time I don't be knowing what nobody doing. They telling me what we doing. But we gonna be installing. So I think the program gonna start like in August. So if you're interested or even think about getting solar for your home, let us know. But that's for the city of Atlanta. But if you outside the city of Atlanta, DeKalb County, they have a portion of the money. So it's Savannah, Decatur, and Atlanta got $156 million to bring solar to certain, MPU. It was supposed to be certain areas, but since we got somebody else over there, now it's open to everyone, which I really appreciate. I like that part. So you ain't got to be in a certain MPU.
So certain
And we do
areas
we,
that
we,
you get.
and we do free energy audits. We got sponsors like Google. Oh, Lord, I was sitting here thinking, oh, okay, we gonna get. I was like, I gotta talk to Tanya. I know where we can get some money for that, for that, for that, for that. Because now that the Medicaid is going away, I think this 52% of uh, young black women are on Medicaid, and so I was just sitting here just like thinking of things to help you. Yeah.
Thank you. Yeah,
Yeah.
she's a wealth of information, y'all. She's a wealth. So if you in the city and if you in Atlanta, you can get solar panels for free. For free. For free.
Yeah, so I'm a self-proclaimed rainmaker.
Make it rain, girl. Make it rain. I love it. Yeah. Thank you, Tanya. I really appreciate you. Thank you so much. So part two to my gratitude to my special panelists. I would like to give you all nice foot. Sorry, Brandon. Sorry, Brandon. Foot care. It's pampering the feet with peppermint, but compliments of Azuri. Thank you. Thank you. Yes. Yes.
The best.
So now know that everyone can go and get them a thing right tomorrow. Yeah. So we'll give you information on where to go pick it up. But I have the panelists there today. Okay. Thank you again. I appreciate you. Keep looking out, night. We're gonna do more of these events, you guys, at least quarterly. Okay. Yes. All righty. All right. Go get some juice. Let's talk a little bit more about Region RX. Okay, listen up, ladies. We got Region RX over here. Oh, picture of okay. So, okay, before everybody start moving, talk to them about Region RX. Like that. Okay. Yes.
And everyone, before you leave, come over and see Region RX, as well as the Detox from Barbie and House of Tea. Please stop by and see our wonderful vendors.